Up next is Lauren Capozzi. She's currently working towards her Master of Science in Kinesiology at the University of Calgary with Dr. Coast-Reed. Her research will examine the role of physical activity, education, and programming in the clinically underserved head and neck and neuro-oncology populations. So Lauren is interested in the use of physical activity and health education to promote self-empowerment for those living with cancer. And she has strong belief in the importance of knowledge, translation of developing sustainable community programming that will promote health and wellness for cancer survivors throughout their cancer journey. Lauren has research funding from the University of Calgary. So if all could give a warm welcome to Lauren.
Thank you, Jason. Thank you. Can you hear me? Is this working? I'm usually loud enough. I usually don't need microphones. I've been told my whole life. So if I start screaming at you, I'm sorry. Okay, this is the last slide, so we need to get to the first slide. So maybe I'll just... Am I doing this, or are you guys doing this? Whoop. Okay. Like Jason said, my name's Lorraine Capozzi. I'm a graduate student with Dr. Coast-Reed at the University of Calgary. I have been working in this area for quite a few years. I did a kinesiology degree and a science degree at U of A. I did some program development stuff back home in Kelowna. And my dad actually had cancer, so I have a close connection to working with people with cancer and knowing the effects of health promotion programs on people with people with cancer. So I have a lot of passion in this area. And the first two presenters, I have a lot of respect for the research that they've done, and I hope to take some of that research and implement it into community programming that some of you, it sounds like, have already accessed, which is fabulous. Okay, let's see if this works here. So I'm going to talk about a few things today. My research specifically is looking at underserved populations, so head, neck, and neuro. I was told to talk about that just in case we had a few people with head, neck, and neuro cancers here. But generally, I'll talk about programming and steps that you can take today to start getting moving. So hopefully, it's beneficial for everybody. So the two speakers that we've already had have talked about these first few slides as just a review. So we know that the evidence has revealed physical activity and exercise. So physical activity is the big, broad, all-encompassing, your household activities, your walk to the park, all of that. Your exercise is your planned activity. So we use those words interchangeably sometimes, but they do mean different things. And today we're trying to promote you to increase all of your physical activity. So your household, your daily routine, parking a little bit farther away from the grocery store, things like that. Whew, I'm blinded by this light. Okay, so we know that the evidence shows safe and beneficial before you start treatment. So a lot of you, if you were at increased fitness level before you started treatment, we know that that will help you throughout your treatment regime. During treatment, post-treatment, so there's a lot more research to show the importance of survivorship care. And the reason for that is that people are living longer with cancer. So we want to promote quality of life after you've gone through your treatments. And there's even some studies in palliative care as well. So the great thing about physical activity is we'll talk about the physical benefits as well as the psychological benefits. So the first two speakers touched on the physiology. A lot of the research that I look at with Dr. Coast-Reed, my supervisor, is on the quality of life aspect, so the psychological component. And of course, both of them together gives you the full benefit of physical activity. So physical improvements, I've already mentioned that improved health status to allow the initiation of difficult treatments. There's research to show that throughout your treatments, exercise can help promote can reduce the symptoms and side effects, including pain, nausea, sleep difficulties, the big one, fatigue, that we've already talked about today, blood pressure, and hospitalization time. We also see, Dr. Friedrich actually already talked a little bit about improving treatment completion rates with a few of the studies that they did with breast cancer survivors, which is an excellent finding. So we know that those who can stick with their treatment plans will be more successful in long term. So physical activity helps people to stick with their treatment plans. Again, this research has been done in specific groups. So like they touched on breast cancer, prostate, a little bit on prostate, but colorectal cancer or colon cancer. And that's just because, so we present generally, but we don't have the research for each specific group yet. There just isn't the number of studies. We still, generally we know that there's positive benefits for everybody. So I'll talk today to all of you who have different types of cancers. Physical functioning. So immune factors, we have a postdoc working in our lab right now that's working with children's cancers and looking at improved immunity with physical activity. And the next few are what I feel is really important. So physical functioning, your cardiovascular fitness, muscular strength and endurance, and joint mobility. So that allows you to do the things that you usually do in your daily life and that you're used to doing. Sometimes when I give a presentation, people usually come to me, and we actually had one of the survivors already mentioned, Jillian from The Biggest Loser, and they think that I'm going to get them to run a marathon or who knows what, or big biceps for the beach or something like that. And I think the most important point is to understand that our goal here is to help to improve your physical functioning, to help you to do the things that you like to do in your daily life. So everything from picking your groceries up onto the counter to going out for a walk with your dog, things like that you may have noticed were compromised throughout your treatment or following your treatment, maybe due to fatigue or just muscle wasting. I work with the head and neck group right now at the Tom Baker. We see a lot of muscle wasting because of their treatment, so helping them to get moving again is really important. And then body composition, which Dr. Friedrich already talked about. So that's your muscle mass and your fat mass, and helping to get that in a healthy ratio, okay? And this was already covered as well. So the latest survivorship research that's been done in breast and colon cancer, we see reduced risk of cancer recurrence in some of these studies, and then reduced risk of cancer-related mortality and all-cause mortality, which is quite exciting research. Next. Can someone flip the slide for me, please? Thank you. Whoopsie. There we go. So this is the other side, the psychological benefits, which are really important. I think when someone's diagnosed with cancer, there's a large part of them that feels out of control of their cancer. I remember with my dad and quite a few people I've worked with, talk about feeling out of control of their own body. Lots of people say that they tried to live a healthy life, and why did this happen to them? And I think physical activity is an excellent way to take back that control over your health and wellness. For all of us sitting in the room, so even if you're a support person, this is an excellent way to empower yourself, to regain your health and wellness throughout your treatment or even as a support person. We see when we look at psychological well-being of people throughout their treatments, we see reduced perceived stress, anxiety, and depression. And this is really important because if you're not living with a positive quality of life, then it's to think about how to say this, but the most important factor, I think, is living with a really good, strong quality of life. And I think that's why we focus on this research, because survivorship research is really important and long-term survival is important, but we want to make sure those years are filled with quality. We also see improved body image, self-esteem, coping skills, and then that quality of life. So this encompasses your physical functioning, your social functioning, your role functioning in your family or in your work, so if you're going back to work, and cognitive functioning. Can you flip for me, please? Thank you. So what really interests me and what my research will focus on is this knowledge translation piece. So now we have the evidence, and you can see I have these arrows here, so we know the benefits of physical activity, both physical and the psychological benefits. And now we need to work at this knowledge translation, or getting the development of community-based programming. We want complete care. I was at a talk a few weeks ago, a fellow named Dr. Block from the States who've developed this big integrative cancer care facility or center. Some of you may have also been at this talk, and he mentions that when you come into his center, you get a full psychological assessment, a dietary assessment, a physical assessment, and when you walk in, there's a full exercise center and a dietary center where they have a demonstrative kitchen. And he talked about having integrative care, so allowing for all of those components of life to be addressed. And I think that's our goal in the future, to have these programs where you not only get your medical care, which is very important, but you also get all the other care in one center or maybe in a number of centers, but you have that complete care or that integrative care. We also need this programming to be sustainable. So we need funding and we need the personnel who are educated in physical activity and cancer care to be in centers so that it's sustainable, so that it can be accessed for a long time. And we need support from healthcare providers and healthcare providers that have that information. So one of the barriers that we face or used to face, like Dr. Friedenreich talked about, is a few years ago there wasn't enough research to show the benefit of physical activity, and some physicians may not recommend it for that reason. And now we know that it's very beneficial, and so having the support from the healthcare team at the Tom Baker, which we are getting, is fabulous and going to be very helpful. So the future, our goal is to have this clinic-based physical activity educational programming or physical activity programming and it may also not be clinic-based, it may be outside in a community center. Some of you have already accessed some of these programs with Yoga Thrive or with the Thrive Center that we have at the U of C. And there's other ones throughout Calgary as well, which is really good. And again, focusing on patient empowerment, so like I talked about before, the benefits of empowering yourself because you have control of your physical activity and your choices there. So I'll talk a little bit about clinically underserved head, neck, and neuro-oncology populations, but I'm not sure if too many of you are from this, so I'll zip through it pretty quickly. I put a little breast cancer pin or a symbol on here because some different cancer types, including breast cancer, we have a lot of these programming starting to be developed because there's a lot of research there. And other programs we're struggling a little bit, just because we don't have the research yet. In these populations, so head, neck, and neuro, we know that there's increased distress, increased quality of life issues, and increased barriers to physical activity participation, just because we don't have the programming available yet. We also know that there's decreased community resources, like I just mentioned, and clinic-based programming. So I have a few different examples here, and this also may apply to different cancers as well. But this is first looking at the brain tumor population, which I work with. There's some exciting research that we're talking with a few oncologists right now about cognition studies and physical activity, and even just helping to manage a body weight throughout treatment. So we know that people from neuro populations or brain tumor populations are interested in physical activity programming, like many of you may be, but just didn't have the ability to access this programming. We know that muscle wasting and weakness occurs due to some of the drugs that they're on, so a lot of muscle wasting occurring, so they feel like they're limited, they can't do the things that they used to do. And we also know that they notice or they have weight gain with certain medications that they're on. And we know with physical activity that we can help prevent that muscle wasting or help afterwards with rehab to build muscle back and help prevent some of the weight gain. So this is a good intervention or a good opportunity to intervene. One of my colleagues, Michael McKenzie, who's a PhD student in the lab, is going to speak after me or later in the evening and talk about yoga. But as many of you know, we have a yoga program Dr. Koulos-Reed has been researching for quite a few years. And again, she's transitioned it into a community-based program, so a few of you have already accessed that. And we're now doing a study with brain tumor population with this yoga program to look at the benefits at quality of life, and a lot of them are really enjoying the program, which is excellent. The last little spotlight I'll do is on head and neck cancers. And I've been working with this group quite closely lately. And we see that they also have this demand for activity programming, but there isn't any available right now. And we know that patients face a lot of muscle wasting. I've worked with quite a few clients who have told me that, or patients who have told me that at the end of their treatments they couldn't get off the toilet seat. They had lost so much muscle in their legs, and they had to fall from a chair to get themselves back up or use their arms. And we know that it's just a side effect of the treatment, and it's unfortunate, but this is maybe a time when we can intervene. There's a number of studies, or a few studies in the States, that are looking at the muscle wasting and using resistance training to help prevent this. So it's quite exciting. It's very new, but a really good opportunity. And similar to the brain cancer population, trying out with yoga and seeing if this would be a good transition into yoga into a greater program after they're done, or a bigger program after they're done. So the next little part is how we get moving today. I think that it's really important to have a practical component to the talks tonight because you're getting this information. I'm sure you're all very motivated and you want to start tomorrow, and I'm going to tell you that I have a class I teach tomorrow night so you can all come, okay? So how we get moving. So I think this is a cute little cartoon. If you can't read it, the lady with her weights, she says, "My routine lasts an hour and a half. 15 minutes of cardio, 15 minutes of weights, and an hour of talking myself into it." And I know this is true for most of us in the room, not just the cancer survivors in the room. So how do we get started? And the biggest thing is having proper support, so supportive care, and having the right team around you. So we don't expect that you're going to do it on your own, and we want to help you along this journey so that you can empower yourself, but you have the skills to do that. So we'll talk about a few practical things. We've already talked about setting goals a little bit, goal setting. But I think when you take a step back from goals, you need to find your motivation. So what is that for you? Is it the evidence that you've seen tonight? Is it a kid or a grandkid that wants you to come out and be physically active with them and wants you to continue to be healthy? What is it for you that motivates you? Is it fatigue and you want to help work on managing your fatigue? So I think if you find that motivation, you can continue to come back to it. Even when you're feeling like it's challenging to stay on a physical activity routine, you can come back to this, which is really important. The next thing is goals. What are you going to do and how are you going to do it? Okay? So it's New Year's resolution time a few months ago, and everyone can say, I'm going to start exercising. But you need to know what you're going to do and how you're going to do it and how you're going to take the steps forward. All movement is beneficial. So we've talked about the planned exercise, so coming to the gym. We have a brand new gym at the U of C that's free for cancer survivors, and you're welcome to come and attend that. I'll tell you a little bit more about it. Maybe it's coming to the gym. Maybe it's just in your day at home, walking a little bit more. So there's one lady who comes to exercise class every Monday and Wednesday at Wellspring that I teach. She said throughout her breast cancer treatment, she promised herself she would move every day. And sometimes it was a walk around the block, and sometimes it was a walk around her kitchen table. And she just had to listen to her body and really assess, what am I able to do today, but no matter what, I'm going to move a little bit every day. And I think that's an excellent goal, and all movement's beneficial. We also know social support is huge. So if you have somebody maybe sitting with you here tonight, or you have somebody at home or a friend that encourages you to be active, that will help you to stay on track. Maybe maybe it's not the support at home, maybe it's coming to a class where you have friends that encourage you to attend that class. Maybe it's going to the testing lab and getting tested, and you're working with an exercise physiologist who's encouraging you to come back and stick with your plan. So it's different for everybody. Maybe it's your dog that needs a walk on these beautiful sunny days. I think it's also really important to address barriers because we all have barriers to physical activity. So what are your barriers? Maybe you're going through treatment right now and it's the fatigue that you're facing, and that's a really realistic barrier. So what are you going to do with that? Maybe you have to plan for taking more days off. Maybe you have to be reasonable and understand that you're just going to have a little bit of exercise that day, a little bit of walking, or maybe just some stretching. And then what do you enjoy and what's accessible to you, which is really important because it has to be sustainable. You have to be able to continue to do it. There's no point in starting an exercise program and doing it for 2 or 3 weeks and then stopping. You have to continue. Can you flip to the next one for me, please? Perfect. Thank you. So we've already talked about current recommendations. Again, there's a lot of research to look into specific recommendations, but currently 30 to 45 minutes of moderate exercise most days of the week. Very vague because it's individualized, it's different for everybody. Some people may look at this and think there is no way. I'm not moving at all right now. There's no way that I can start doing 30 minutes most days of the week, 5 days a week, or doing my 150 minutes. And maybe for you, it's doing 2 times a week going on a 20-minute walk. And maybe the 20 minutes is too much. You need to split it up and do 10 minutes in the morning and 10 minutes in the afternoon. So it's really important to assess where you're at right now. Working with somebody individually can help you do that. And then plan a program accordingly. Okay, so first step. So try and incorporate all 3 types of activity. Okay, so aerobic conditioning. Does everyone know what that is? That's your cardio. That's your walking, your biking, your hiking, your running, swimming, whatever that may be for you. You're getting your heart rate up. So, and we suggest to work at a moderate rate there. So if you look at this scale, which I think already came up tonight, so working at moderate, it's different for everybody. So your scale is going to be different than the person next to you. What you think is 0 or 3 is going to be different than what someone else thinks is 0 or 3. I usually say 0 is before the alarm goes off in the morning, and 10, you've never worked so hard in your life, I'm calling the ambulance. So we don't want to be at either of those when we're exercising. So you want to be around 2 or 3 or 4 depending on your body when you start off, okay? And moderate exercise isn't your nice little stroll down the block. Moderate exercise, you're moving your arms and you're starting to feel that you're sweating, you're perspiring a little bit. Resistance and strength training. So you don't need weights to do this. You can use your own body weight to do this. So I'm doing a push-up. Whoops, I'm moving the table. Using my own body weight, right? So you can do this at home. You can go to a gym or a center and use bands or use different weights that can help you do resistance training. And flexibility, which is really important. So having active commercials at home if your body's warmed up after you've been walking or you've just got out of the bath or the shower so your muscles are warmer, you can do some flexibility or stretching in front of the TV. All 3 have benefits for people. It's really important. And then again, working with someone that can help you use a scale so that you can monitor. So usually when I teach different classes, I hand out a calendar, and I even found this magnetic tape. It's fabulous. So I get people to tape it to their fridge so they can see it every day. And you can use this calendar to plan exercise. So you can see on here, Wellspring exercise class on Monday, going to the Thrive Center on Tuesday, whatever it may be for you, going for a walk with your friend Jim on Saturday. Or you can use this to record your exercise so that you have a recording device. And I think this is useful for people because they can look back a few months before and see that they've really improved on what they can do. It also keeps you accountable. Just like you schedule a meeting at work, it's important to schedule your physical activity. Okay, so take-home messages today. Starting slowly and building gradually, I think, is very important. A lot of us can get ambitious, but we have to be careful, and we have to listen to our bodies. Seeking safe and supportive programming to help you. So I think it's really important for people to know you can take a weekend course and call yourself a personal trainer, or you can go to school, get a degree in exercise physiology or kinesiology, and get extra certifications, your CSEP certification, so some of the physiologists at the back, and including myself having a designation through another governing body. So we have many years of school, and then we can prescribe you exercise and call ourselves a personal trainer. So make sure you're checking with the person that you're working with so that they have the credentials to help you. Set your goals and track your progress, and focus on what you need. So balancing exercises and functional exercises, okay? Really important for us, so working on those and having fun with it. So really quickly before I end, just want to show the Thrive program which we have. So we've talked about this a little bit tonight and what we focus on. So we offer education. We have a session, I think I've seen a few faces. The first Wednesday of every month we go into more detail about planning an exercise program. We have education programs for head and neck patients. We have one for prostate cancer patients or survivors, and other talks available upon request. We have the Yoga Thrive program. So most of you have received a handout from our booth over there with the number. If you're interested, you can call. 7-week Yoga Thrive program. And then we have the new Thrive program, which is the lab in the center. So you can get tested using Dr. Smith's research program and work with one of the physiologists, get tested. And then you can also come to the center. So we have this great new center at the U of C with this beautiful new equipment and trained kinesiology undergraduate and graduate students. We have open gym times which are free for you. You can come in and use the center. Okay? And then we have exercise classes, which I teach at Wellspring on Monday and Wednesday evenings. So Monday, it's from 6:30 to 7:30. Wednesday, from 6 to 7. You're all welcome. We're going to have a big class tomorrow. I just know it. So here's our gym facility up at the top. And then here's our lab facility below, so you can see the pictures there. And then just a little bit more information on the free fitness center we have at the U of C. And all of you have this in your pamphlet. That's my last slide. Thank you very much.